Improving better outcomes for patients is really what medicine and surgery is all about.
Any major institution should have a research arm.
Without research, nothing changes.
It might be your relative, it might be your friend, it might be your neighbour who has these conditions.
And it's been very well shown that if doctors and nurses and people around medical institutions do research, then the patients do better and the institution does better.
The Wesley and St Andrews Research Institute provide funding which will enable research to occur which may not otherwise have occurred.
They provide the facilities on site in a major hospital that allows us to do our trials.
The work that we have been doing so far within Huntington's disease has been looking at inflammation and where inflammation may play a role.
We have a drug that is working in mice. We want to take it to the next step and take it to the clinic.
So what we're doing is gathering data from all of the hospitals before the digital system came in and also after, to look at whether patient outcomes have improved. So if there's a reduced rate of medical errors, you reduce the length of stay, you're not only improving the patient's experience in the hospital, but you're reducing costs, which is huge.
We've been looking at the role of viruses in breast cancer because there's been a lot of interest in this area of late. But this is quite a new area, a new field of research that we've been working on.
Our tissue bank is the only tissue bank in Australia that collects all the different types of conditions. Our role is to provide samples and services for researchers. We take the hard work out of speaking to patients, collecting samples, blood and tissue, and provide them to medical researchers across Australia.
What we want to do is get them all into a bank where researchers can really look at them so we can start to make progress.
Endometriosis is a condition that they think affects 35% of Australian women. One researcher we're working with, who we've provided samples to, they could have a genetic test. They could pinpoint the genetic markers. We're supplying products for a researcher now who potentially has a cure for the HIV.
We work in the field of brain cancers and we think we're making a real difference. Our research has been published worldwide, we're getting worldwide recognition, and we're expanding those trials into the future with the help of the Wesley Research Institute.
We're looking at the big cures for cancer, the big cures for various defects that are created when patients have surgery. We're looking at various sociological and psychological outcomes. We're looking at a very broad spectrum.
We couldn't do it without the facilities, without the people that work in the facilities.
The Wesley Research Institute wants to achieve better patient outcomes.
Research enables us to improve that process tremendously.
That's so important to get to our target, which is of course reaching the patients with something that works for them.
I'm very confident, in fact, that in the not too distant future we will actually find a cause for breast cancer.
Patients with brain cancers will no longer be given a death sentence.
If I could make a difference in someone's life, improving their outcomes or improving their quality of life with something I do, then I'd be happy.
It makes you feel really good to know that at the end of the day, you're helping people.